Imagine waking up from a deep sleep, knowing that the simple everyday act of sitting down, coughing, or even taking a deep breath could make you black out from pure agony. We live in the golden age of medicine. We have advanced anesthesia, robotic surgeons, and high-tech painkillers. But there is one specific medical procedure standard today where post-op recovery is so universally feared. Patients say it feels like swallowing broken glass and razor blades. Meet Mark. Mark is a regular 35-year-old guy. He has broken bones, he has had his appendix out, and he considers his pain tolerance pretty high. But today, Mark is facing a procedure that doctors openly admit has a cure worse than the disease. Welcome to the reality of the most painful surgery in the modern era. To truly understand pain, we have to look back. Before the mid-1800s, walking into the surgical theater was essentially a death sentence by torture. There was no anesthesia, no numbing cream, nothing. If you needed an amputation in the year 1840, your surgeon's greatest skill wasn't precision. It was speed. The famous surgeon, Robert Liston, could amputate a human leg in just 28 seconds. Why? Because patients would literally die from the sheer shock of the pain if he took any longer. People had to be pinned down by 4 strong men just to keep them from running away mid-slice. Then came October 1846. Dr. William Morton publicly demonstrated the use of ether gas to knock a patient out. For the first time in human history, surgery was silent. It was a miracle. Fast forward to today, anesthesia has gotten so perfect that you can fall asleep, have your chest cracked open for open heart surgery, and wake up feeling like no time has passed. The surgery itself doesn't hurt anymore. But what happens when the anesthesia wears off? You might think the most painful modern recovery belongs to spinal fusion, where doctors literally drill titanium screws into your backbone, or maybe a total knee replacement, where they saw off the ends of your bone. Those are brutal, but according to massive patient surveys and frustrated surgeons, the undisputed king of agony is something much smaller, much lower, and much more embarrassing: the surgical hemorrhoidectomy. Let's look at Mark. Mark suffered from severe, bleeding internal hemorrhoids, swollen, inflamed veins in the lowest part of the rectum. When diet and creams failed, the only option left is to cut them out. On paper, it sounds simple. It's an outpatient procedure. Mark is put to sleep, the doctor removes the tissue, and Mark goes home the same day. Easy, right? Wrong. Here is why this surgery is a living nightmare. Your body's pain matrix is entirely based on nerve density. Your back has nerves, but your lower digestive tract is packed with an unbelievable concentration of highly sensitive pain receptors. Their job is to tell your brain exactly what is happening down there. Now, imagine a surgeon takes a scalpel to that hypersensitive area, cuts out pieces of tissue, and either stitches it up or leaves the wounds open to heal. Worse yet, you cannot rest a wounded bowel. If you break your leg, you put it in a cast and don't step on it. But Mark's body still needs to digest food. 48 hours after surgery, the heavy hospital painkillers wear off, and then comes the moment every single hemorrhoidectomy patient terrifies themselves over: the first bowel movement. Patients routinely describe this moment not as a 10 out of 10 pain, but an 11. It feels like passing literal barbed wire through an open frame. Mothers who have gone through unmedicated, natural childbirth have gone on record stating they would rather give birth 3 times over than experience the first week of this recovery again. The pain isn't just physical, it's psychological. For Mark, the next 2 weeks become a mental battleground. Every meal he eats comes with a wave of anxiety because he knows that what goes in must eventually come out. The standard treatment, sitting in a shallow tub of warm water, called a SIDS bath multiple times a day, just to soothe the spasming muscle. The sphincter muscle naturally wants to clench when it's injured, but clenching causes more pain, which causes more clenching. It's a vicious, agonizing cycle. And because it's an embarrassing body part, many patients suffer in absolute silence, unable to tell their friends or co-workers why they can't stand straight or why they are taking a month off from work. But there is a light at the end of the tunnel. By week 3 or 4, the tissues finally begin to mend. The spasms stop. The razor blade feeling fades into a dull ache and eventually disappears entirely. If you ask Mark today if it was worth it, he will tell you yes. The chronic long-term pain is gone. But he will also tell you he would do absolutely anything to never ever have to experience that recovery again. Modern medicine can save our lives, straighten our spines and repair our hearts. But sometimes the road to healing still demands a heavy tax in human suffering. So, next time you think a paper cut hurts, just remember what Mark went through. What do you think? Is there a surgery recovery you have experienced that felt worse than this? Let us know in the comments below. Hit that like button and subscribe for more deep dives into human body. Until next time, stay healthy.